Hello YouTube. This is a video where I'm going to talk about how we found out my mom had cancer. She came to live with me in January, and I could tell that she was sick because she was losing weight. But we didn't know what. I kind of suspected that it may have been cancer, but I thought maybe, well, I don't know what I thought, but I kept telling her she needed to go get a pap smear. But she never did. And so she just kept losing weight and kept losing weight. And she had, her job had closed in March of 2013. So she didn't have a job. She didn't have insurance. And she was getting, unemployment. She was getting unemployment. And so that ran out in January. So pretty much that's how she didn't go get the pap smear. So she was in pain. She was complaining about bone pain and muscle pain, and we went to emergency a few times, and they said it was arthritis. Gave her pain medication, sent her home. Anyway, fast forward to July, and we were visiting a relative, and she was climbing stairs, and all of a sudden she just let out a loud scream, and she just went down on the ground. So we got her to emergency, and same thing, arthritis, but she still complained about bone pain and muscle pain. And when we got home that time, she wasn't able to walk. And so I think maybe the same week that happened, I was on vacation, so I just went to a med stop just to ask for some advice. Med stop is kind of like an emergency room, kind of, sort of, but not really. But anyway, I just went to a med stop and asked the nurse for some advice on what to do. I told her the story and what was going on, and so she told me to take her back to the emergency room and have them to do x-rays, and if I couldn't get her in a car, to call the ambulance. So that's what I did. So when we did that, I asked the emergency room doctor to do x-rays on her hip and on her back. And when he did that, he found out that her hip had a fracture. And after he found the fracture in her hip, he also said hemoglobin level was a 3, and it should be about a 12. So he told her she would have to have a blood transfusion, and she had a rare type of blood, and they would have to locate some blood for her. He also told her that she would have to be transferred to a different hospital because we're in a small town, and that hospital would not be able to service her. So anyway, we got her transferred to a different hospital, and they ran tests and everything, and maybe about a couple of days later they came and told us that she had cancer. And they just kept giving her blood. I don't know where the blood was going, but she just couldn't keep the blood. She may have had about 15 blood transfusions, and they had to do surgery on her hip. So they wanted her blood count levels to be up so that she could get through the surgery. And the doctor, when he came to explain to us what type of cancer that she had, he said that it was multiple myeloma, which we had never heard of. Apparently it is a cancer of the blood, but it affects your bones, and they're thinking that's probably what caused her fracture in her hip. So anyway, she did go through the surgery. She lost a lot of blood in the surgery. However, the surgery was successful, but they still had to keep giving her more blood and more blood. And so finally she was able to come home from the hospital. Needless to say, it has been an ordeal, especially with finances and her not having insurance, and it has just taken a toll on the household. It seems like the house has just become the cancer has just taken over the household. So right now what I'm trying to do is find a balance in the household to get some type of order, because it seems like we're going to be fighting this for quite a while. All that happened in August, so it's November, and she's doing, okay, she's so. We had tried to get insurance for her, but we couldn't find anything that she could afford. So we had a representative to call us from the Affordable Health Care Act. We had a representative to call us, and he told us that it would be best for her to try to apply for disability and Medicaid. And so she did that and was denied. She was denied twice. And so she's going through an appeal now. And that's one place I never want to be in. I hope that I never am in a position where I have to depend on the government to give me some type of assistance. But anyway, she's doing a little bit better. I think we have a long fight. We just have to make some changes in our lifestyle. But I am so appreciative of my supervisor and our human resources department. They have been so helpful and relieved a lot of stress and given me an opportunity to work late or come in early to make up time that I've had to miss work, taking her to chemotherapy or to doctor's appointment or wherever I needed to be. So thank you to everyone for your thoughts and your prayers, and we will keep you updated on how she's doing.